Welcome back to the Discourse KE after a long period of time, and we are so glad to be back and to bring you the most intelligent, educative, and also thought-provoking conversation. Today, I'm joined by the chairman of the Kenya Society for the Blind, that is Samson, Waweru, who is going to give us insights on what this is all about in Kenya. Welcome, Sam.
Thank you very much, and it's nice to be here.
Yeah. So, the Kenya Society for the Blind. Tell us, what does this really entail? Do people know about this society? What do you people do?
The Society for the Blind is well known, I would say, by people, but sometimes we choose what to know in a popular way and what just to know, and it's at the back of your mind. And the society is one of those entities that we feel is always at the back of the minds of so many people, although they know it, but they know it better once confronted by an issue of blindness in the family or in their lives. So that's what I can say about the knowledge that generally people have about this society.
So in short, people only relate to it when it hits home and they have someone who is blind.
That's it. It hits home. Even the government knows it when it hits home.
So does that mean that the government have been sidelining the Kenya Society for the Blind?
It means that actually it's the government that thought of having it created back then, because we were created in 1956, and we were created because our soldiers came back from the Second World War, most of them injured and most of them having lost their sight. So no one was ready and willing to take these soldiers and look into their welfare. So then it was necessary for the government to establish a society for the blind so that they could be rehabilitated and they could be reintegrated back to the society to continue with life and try and do something else.
Okay, quite an historical background there. And what about the opportunities? Do you think you guys have been accorded opportunities with people who are not visually impaired as you guys?
I think on that I would like to start from how the society was established, because then the reason why the government established the society was because of sympathy to the soldiers that had come back home. And then the model of disability, of looking at disability, was sympathetic. So these models started evolving from charity, which was guided by sympathy, and this was not sustainable because sympathy is short-term. So anytime you accord sympathy to a person, after you leave them, they fall back to the same problem. So that couldn't work.
So you guys you don't want anything to do with sympathy, because sympathy look like it's not a sustainable plan.
It is not a sustainable plan, because once you come and sympathize with me, what next? You can come and cry for 10 minutes on the fact that I'm blind, then you leave and go. What do you think then happens to me? So that's why we say empathy is the best approach to looking at disability, because with empathy, you then give solutions. So this person is blind. What do we need to do to make their life better? So,
so far from the history that you've just given me, do you think much of the progress has been made so far in the society, especially in Kenya and the world?
Yeah, significant progress has been made with what I'm telling you now, the change of perception and how you look at disability, from the charity model to the medical model, where people now thought, could we treat disability? And also it could work to some extent, but really not work. So that was the first intervention of trying to deal with disability. And when it didn't work, it came now to the social model, because they found out that even if you're treating somebody, once you treat them, they go back at home and they stay isolated and segregated with nobody to talk to them. So this necessitated then for people to think of another approach, which is now the social model of disability, whereby discoveries were happening in faraway places like Europe on how people could learn. And for blind people, Braille was discovered, that it would be a nice way of teaching blind people and taking them through the same education system that you take these other people. And I see this is where we started seeing a lot of transformation from the social approaches. This is where now opportunities started being accorded in an empathetic way and not in a sympathetic way, as I just highlighted.
Yes, coming to the perception of people with disability and also the lingua that's being used with people with disability. We've seen that in most cases. The other day I was with people who are deaf, and we had a meeting, and they say that people, especially in journalism and media, they don't always get it right when it comes to defining them.
Yeah.
So is it the same case with you? Because they say sometimes you use terms that are not really related, or they are degrading to them. If someone may use like people who are deaf and dumb, they're not dumb, they're only deaf. Is it the same case with you people?
I think for us, what I would say is a question of identity and disability. And for us, blind people have no identity crisis. We are very comfortable when you call us blind. But there are those people who have limited sight that is maybe dwindling. And when you refer them to as blind, they may be offended. So we use a visually impaired person or a person with visual disability. That is the term that is regarded to as respectful as it comes to blind people. But most of us who have always been totally blind, we are just okay being called a blind person. We have no problem. But when you talk about perception, this would also point to the fact that people try to think how they treat us instead of asking us directly how we would like them to view us or to perceive us. And I think that's where most people get it wrong. There would be no problem if you came and met me and asked me if I need any help, rather than just coming and picking off my hand and pulling me to a direction that I don't know where you're going. So it's all starts and ends in communication when it comes to people who are blind. We would appreciate that communication.
So the communication is much important.
It's much important, and it shows there is some respect, and there is some form of just some form of knowing that this person can speak and you can relate with them, and so you can ask them directly what they need and they'll tell you, and with that you'll get along really very, very well.
Okay, now getting to the challenges.
Yes.
The challenges that you guys have been experiencing. Earlier on, you had mentioned that most of the organization, they tend to come when they've already knocked, they've reached the back end of it.
Yes.
Now, how has this been? Does it mean that people only come to you when they have the need to? Or how have you guys been working in partnership?
I will answer it in two ways. One is that the manner in which the society was created is because there was a calamity and people needed assistance, and they were assisted and it worked. Then because there was no calamity but people were getting blind, the stakeholders who could have been responsible in taking their welfare into another level went and forgot. Then we stayed until 1998 when there was another calamity of the bomb blast, where many people were blinded. Then focus was given to the society. That I would say, when it comes to the actors, the government, and also the non-government, non-state organs. So when it comes now to people, it's the same. You don't realize you need to do something for people who are blind and visually impaired until someone in your family goes blind. That's where you'll ask, by the way, there is a school I see those people going in with white canes, and I think that is the school that can really help this person. So you even don't know what it is. But what we say is that disability is a very open club. Today you're sighted, tomorrow you wake up blind. So we can make this bed comfortable for everyone before you even lie in it. So that's why we ask that we need to be concerned and we need to look into these matters with an open mind. Yeah.
You are the chairperson of the Kenya Society for the Blind.
Yes.
And this is your which year?
Second year.
Your second year being the chairperson.
Yes.
What are some of the things that you've implemented in the society?
Well, the thing that I found in the society was that blind people were much disenfranchised with that organization. Despite it being an organization that takes the name of these people who are blind and visually impaired, it really did not reflect in its workings the fact that blind people participated in it So when you go to see how people are employed in the society,
Yes.
you find 1 person out of 15 is blind.
Yes.
When you go to services that are offered, there is nothing offered for the blind. But when you go down to the village, there are many problems. So the first thing I did was bring a strategy to make sure that the society is owned by blind people.
Yes.
Meaning we got into the board 3 blind people, which was not the case previously. Then from that, we were also able to make sure that out now of 15 staff, we have blind people in the society. So there has been a gradual increment of employees
Yes.
working for the Kenya Society for the Blind, because we believe we cannot be a society for the blind where blind people are not given opportunities to work in there. Secondly, we started a very robust institutional strengthening, so that because the society does not receive any funding from the government, it depends on membership subscriptions, donations, and grants. So one membership, people are not subscribing, people are not honoring their annual obligations. And so there was a strategy now to give information to people on what happens at the society, especially with the updating of our websites, Facebook and Twitter. There was a lot of activity with giving food packages to blind people during the COVID-19. And when you have those activities, people then remember that they should honor their obligation as members of the society. And then when you come to donations, donors want reports. Once they give you some money, you have to account that this is how you've used this money. You give a report and you give a letter of appreciation. So that communication, we also came and started implementing it, and it's giving results, because a donor will come back and say, what else can we do? And you see now this brings more activities. And then we really didn't have people who could write grants that could attract funding. So that is something we are still working on, so that you can have people who can write proposals and concepts that will bring more resources to help and intervene when people need this assistance.
Yes, you've talked about the government, and we have a constitution that gives provision for the people with disabilities. Do you think that the constitution has been implemented in effect in regards to giving opportunities to people with disabilities?
It's been implemented gradually.
Yes.
And somehow helping some cadres of disability and leaving out others. Because like now, when you look,
discriminatory.
You would call it discriminatory.
Yes.
I would say it is leaving out some other people. You see, when you do something called inclusion,
yes,
you include people wholesomely without leaving anyone behind. But when people go to apply funding, it depends with what kind of disability someone is and how they are advocating. Because you see, government allocate funds. So when we had Senator Isaac Mwaura in Parliament, he advocated for persons with albinism to be given funds, and they were given 100 million.
It's true.
Now some people have advocated for people with autism to be given funds. They'll be given. Actually, they've already been allocated. So we have also approached a nominated Member of Parliament, Honorable David Sankok, to ensure that also blind people are given money through the Kenya Society for the Blind, which is actually established by government the same way the Law Society of Kenya, the Children Welfare Society of Kenya, the National Council for Persons with Disabilities. If you are giving all these entities money, why discriminate blind people? Also give them something.
Does that mean there is a sort of a friction between people with disabilities internally? Because we have different groups. We have the visually impaired, we have the deaf, we have the autism, we have the albinism. And from what I'm getting, what you're saying is that some organizations have been given money, others have not been given money. Don't you guys have a pool with people with disability where we can get their funding from?
You see now, the National Council for Persons with Disabilities that was established in the year 2003 through the Disability Act is the umbrella disability body that is funded by government, and it's supposed also to fund these other organizations or all people with disabilities. So for the National Council, that is its mandate. But you'll find different disabilities have different challenges. You see, so like persons with albinism, they have the challenges of sunscreen, and that's why they made a petition to justify why they should get funding. Also, persons with autism need some form of care, and they made a justification on how they should get funding. For persons who are blind, their life is generally expensive.
Yes.
Like the way we used to be in the same class, you could say I used to use a Brilla at the first time.
Yes, yes, yes.
That is my pen,
Yes.
and it's 100,000 bob. So if the university doesn't get it for me, which it didn't, it meant I needed to look for 100,000 bob for me to have the pen that you had in class,
Yes.
to be able to take notes.
Yes.
So we want to use also that to justify why we should also not be left out when it comes to being given some form of funding, so that even these kids in high school can also get important devices like scientific talking calculators, so that they can also do well in mathematics, which is not the case currently.
Yes.
Yeah.
True, and I've seen it in your website. You guys are doing quite amazing job, and you have some of the projects that you guys are doing in terms of education.
Yes.
And also, I think in terms
Eye care.
In terms of eye care.
Yeah.
Can you kindly shed more light to that?
Yeah. So our mandate, as established by the Act, first is to help and enhance the prevention of avoidable blindness.
Yes.
And this is because many people go blind. Right now, when you go to the website of the Ministry of Health, you realize that 10 million Kenyans could go blind tomorrow. This means that 1 out of every 4 Kenyan is at the risk of going blind. Yeah.
Yes.
It's actually not a projection, because when you go to do an eye screening,
yes,
you'll find maybe 3 people, sight is okay. 1 person,
yes,
there is a problem. So where's the problem? The problem is people do not come out for screening.
yes.
Out of these 10 million people who could go blind, 8.5 million cases can be treated easily very early with only eye drops or glasses.
Okay.
Those are treatable cases.
Yes.
Because there are things like diabetes, retinopathy, glaucoma, trachoma,
Yes.
and all those kind of eye health issues.
Yes.
So that is a calamity already.
Yes.
So as a society, we have various programs. We have an eye screening and medical camp approach and events that we use,
yes,
to go and do eye screening for kids in schools.
Yes.
We also do medical camps for different counties. Last year we were in Kisumu. This year we are going to Turkana. So once these problems are identified, they are treated. Interventions are brought on board and people are treated. And then we have a national hydro production unit. This is a very ambitious project where we have manufacturing plants for low cost and affordable eye drops.
yes,
More than 28 types, because we've been importing eye drops from Europe and other countries. So we feel for the first time in Kenya, we need a factory that can produce low-cost eye drops and supply them through KEMSA to all hospitals, so that those cases that are treatable can be treated. And then we have optical shops where we sell also low-cost, affordable, quality glasses, because we work with government ophthalmologists to identify cases, and when they recommend certain glasses, you'll find that the Kenya Society for the Blind is the cheapest when it comes to low-cost, affordable, and quality glasses. So that's how we intervene. In the education and rehabilitation, anybody who goes blind today in this country will have to be brought to the Society for the Blind, for them to be trained on how to daily living skills, how to wash themselves, wear their clothes, how to walk comfortably without fearing, how to use a computer to read and to write. So if they were employed previously, they can be reintegrated back into their places of employment. And also in the education, we work with schools and the Ministry of Education to identify, assess, and place kids in the right schools that they need. And then we also work with donors to get resources and equipments that are needed by schools, so that we take them to these schools that need these equipment. And we've done a program called the Kenya Integrated Education Program with Sightsavers International for so many years, till 2013. But we've had other partners now coming on board, and they decide to buy maybe education assistance of like 5 million. We buy all those goods and then we take them to different schools.
yes.
So those are some of the programs that we do.
Yeah, and now that you mentioned some of the programs that you do, how can people reach you as we go and wrap up? How can people reach you? And whenever one who becomes blind, how can someone, what's the stage? Because this is another new world.
It is.
This is another new world.
Yeah, so
someone is being introduced to that world. So
first and foremost, I would just say on a lighter note that we've decided to be very selfish. We don't want people to lose their sight.
Yes.
Let those of us who are blind stay here.
Yes.
So those of you who have not crossed the divide, take the advantage of having your eyes checked in good time.
Yes.
But in case there is someone who now's sight has been confirmed to be irreversibly blind, the society is located along Maimahi Road, off Langata Road at Timol, next to Moi Education Center. That is where the society is. And then we can be found on our website on www.ksblind.com. And then, as I said, the society is not funded by the government. It's funded by well-wishers and people of goodwill like me and you, donors and grants. So if you are well-wishers and you like to fund something for the society, you would like to buy a white cane for a blind person. A white cane is a 2,000 bob device. It's what we use to walk. You can become a member of the society or directly donate whatever you have to our pay bill number, that is 955-150. The account number is your name, so that this can go a long way to help boost the programs of the society and the outreach to blind and visually impaired people.
Samson Waweru, thank you so much for coming to the show.
You're most welcome, and it's been my greatest pleasure to be here. And I'm sure I'll come back soon for another terrific discussion like the one we've had today, even if it's on another topic.
Yes, I've been your host, coming to you from Ukombozi Library, Emmanuel Mamadi. Thank you.